Hello, I'm Janice Karen, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. If you'll go to the first slide. So the White House Office of Science and Technology Policy has put out a new roadmap for federal investment in AI. This is the first time that it's been updated since 2019. And they basically have 9 strategies. There's a whole bunch of text under each of these strategies, which you can read if you follow the link at the bottom. Excuse me. And they're pretty straightforward, but as you can see, it's basically making long-term investments, looking at human AI collaboration, making sure things are done ethically, and that all legal and implications are known, ensuring safety, developing shared data sets for training, having ways to measure AI and its impact, understanding workforce needs, public-private partnerships, and having an international coordinated approach internationally. So this is all pretty straightforward, basic stuff, but if you're interested in reading the plan, you can go to that link. I have not read it in a lot of detail, and I think the one that's most interesting and perhaps most puts this aside from other documents is probably that number 2 there, effective methods for human AI collaboration. So I am really looking forward to seeing what they have there. I have not, as I mentioned, haven't had a chance to read it myself yet. Any comments or thoughts there? All right, well, I will report back if there's anything interesting there. Let's go on to the next slide. So this is actually the same office, and they've put out an RFI with a response deadline of July 7th. And they have 29 questions that they're asking the public around AI. And as with any RFI or request for comment or request of any sort, you can pick and choose what you respond to. But they basically have these 6 categories where they have individual questions underneath. And of course, you're also welcome to make general comments on the topics. So some of these are sort of general, and some of them are more specific. You can see advancing equity, bolstering civic participation is probably less interesting from a healthcare perspective, but most of these are applicable, and we do plan to take a look at this RFI after the ONC proposed rule deadline, and if we have time and opportunity, we may make a response, and some of the stuff that we've discussed here at the DGC may wind up in that response. Any questions or comments there? All right, next slide, and if you'll stop there for a moment. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.